If you're a man over 60 who's been struggling with changes in your intimate life, and you've been trying everything you can think of to improve things, but nothing seems to be working, I need you to stop right now and listen closely, because in the next few minutes, I'm going to reveal the 3 most common mistakes men make when it comes to intimacy mistakes that are so widespread, so accepted as normal, that most men don't even realize they're making them. And here's what's frustrating. These mistakes are actually making things worse, not better. They're creating a cycle that keeps you stuck, frustrated, and feeling like you're losing a part of yourself that you thought was gone forever. I'm Dr. James. I've been a urologist for 12 years, and I've spent my entire career helping men navigate the challenges that come with aging, particularly around intimate health. And in those 12 years, I've seen the same patterns over and over again. Men come into my office feeling embarrassed, defeated, and convinced that their situation is hopeless. But here's what almost none of them realize. The biggest obstacles to healthy, intimate function aren't the things they think they are. They're not primarily about age. They're not inevitable, and they're certainly not permanent. They're about specific, correctable mistakes that men make because they've been given incomplete or outdated information, or worse, no information at all. So before we dive in, do me a quick favor. Hit that like button right now. It helps other men who need this information find it. Drop a comment below and let me know where you're watching from. I genuinely love connecting with you. And if you haven't subscribed yet, go ahead and click that button because I share practical, honest health guidance for men every single week. Now let's talk about these mistakes and how to fix them. Let me start by addressing the most damaging myth that's keeping men trapped in frustration and disappointment. The myth is this: when intimate challenges arise after 60, the solution is to focus entirely on the physical mechanics, finding the right treatment, the right supplement, the right technique. And yes, physical factors matter. We're absolutely going to address those. But here's what I've learned from 12 years of clinical practice and thousands of conversations with men and their partners. The biggest mistakes men make with intimacy aren't physical at all. They're psychological, relational, and behavioral. Let me explain what I mean. Most men approach intimate challenges the way they'd approach a mechanical problem. Something's not working properly, so they search for the right tool or technique to fix it. They focus on physical performance, duration, capability. But intimacy isn't a mechanical process. It's a complex interaction of physical health, emotional well-being, psychological state, relationship dynamics, and lifestyle factors all working together. And when men focus exclusively on the physical side while ignoring everything else, they create additional problems that make the physical challenges even worse. It's like trying to grow a plant by only watering it while ignoring the soil quality, sunlight, temperature, and nutrients. The water matters, but it's not the only thing that matters. Here's what's remarkable. I've seen men make simple adjustments to how they think about intimacy, how they communicate with their partners, and how they manage stress and expectations. And those changes alone produced more improvement than any physical intervention had. Not because the physical side doesn't matter, but because they were addressing the real obstacles that were amplifying their physical challenges. So if you've been putting all your energy into finding the perfect physical solution while your intimate life continues to struggle, this is why. You're working incredibly hard on one piece of the puzzle while missing the other pieces that might actually be more important. The good news, once you understand what these mistakes are and how to correct them, improvement happens faster than you'd think. Now you might be thinking, Dr. Narita, this sounds different from everything I've been told. How do I know this is actually true? That's a fair question, and I want to answer it directly. Here's how I know. In my 12 years as a urologist, I don't just treat physical symptoms. I have deep, honest conversations with men about their entire experience, their relationships, their mental state, their fears, their frustrations. And I also talk to their partners, often separately, to understand the full picture of what's actually happening in their intimate lives. And what I've learned is this: the men who make the fastest and most lasting improvements aren't the ones with the best physical interventions. They're the ones who address the behavioral and psychological mistakes that were sabotaging their physical health. I've seen men with significant Physical challenges maintain satisfying, intimate lives because they understood these principles. And I've seen men with relatively minor physical issues struggle enormously because they were making the mistakes we're about to discuss. The difference isn't their bodies, it's their approach. So what I'm about to share with you isn't theory. It's not guesswork. This is what I've observed consistently across thousands of patients over more than a decade of practice. These are the patterns that separate men who improve from men who stay stuck. And once you recognize these patterns in your own life, you'll understand exactly what needs to change. So approach what comes next with genuine openness. Don't assume you already know this. Don't dismiss something because it sounds too simple. The most powerful solutions often hide in plain sight. Let's get into the 3 most common mistakes. Mistake number 3, treating intimacy as pure performance instead of connection. All right, let's start with mistake number 3, and I guarantee most men watching this are making it without even realizing it. Mistake number 3 is approaching intimacy as a performance to be evaluated rather than a connection to be shared. Let me explain what I mean by that. Most men, especially as they age and start experiencing changes, become hyper-focused on physical performance. They're constantly monitoring themselves. Am I functioning properly? Is this taking too long? Am I doing this right? Is my partner satisfied? It's like having a critic in your head, providing real-time commentary during what should be an intimate, connected experience. And here's what happens biologically when you approach intimacy this way. Performance anxiety activates your sympathetic nervous system, your fight or flight response. Your body literally interprets the situation as a threat that needs to be monitored and managed. Your heart rate increases, your muscles tense, stress hormones like cortisol and adrenaline flood your system. And here's the problem. The sympathetic nervous system actively interferes with the parasympathetic nervous system, which is what your body needs for healthy, intimate function. The parasympathetic system controls relaxation, arousal, and physical response. So by focusing on performance and evaluation, you're literally activating the biological systems that prevent good function while suppressing the systems that support it. It's like trying to fall asleep while simultaneously worrying about whether you're falling asleep fast enough. The worry itself prevents the very thing you're trying to achieve. Now let's talk about the emotional impact. When you're constantly evaluating your performance, you're not actually present with your partner. You're in your own head managing your anxiety, and your partner feels that absence, even if they can't articulate it. They feel like you're going through motions rather than sharing an experience. And that emotional disconnection undermines intimacy far more than any physical imperfection ever could. I had a patient, I'll call him Robert, who came to me convinced he needed pharmaceutical intervention because he was struggling with intimate function. But when I asked about his experience, he described constant self-monitoring and performance anxiety. So we worked on shifting his mindset from performance to connection. Just that change, no medications, no physical interventions, improved his situation dramatically within weeks. Why? Because when he stopped triggering his fight or flight response and started being genuinely present with his partner, his body could function the way it was designed to. So what does fixing this mistake actually look like? First, before intimate moments, take 3 slow, deep breaths, ground yourself in your body. Consciously set aside evaluation and monitoring. Second, shift your internal focus from am I performing well to am I fully present with my partner right now? That simple reframe changes everything. Third, communicate with your partner during intimate moments, not clinical commentary, but genuine expressions of connection. I love being close to you. You're beautiful. This feels good. That communication keeps you present and creates connection rather than evaluation. And fourth, if you notice yourself getting into performance monitoring mode, and you will, it's a habit, just gently redirect your attention back to presence, back to sensation, back to connection. You're not trying to be perfect. You're trying to be present. And practically speaking, this means letting go of the scorecard you're keeping in your head. Stop grading yourself. Stop comparing yourself to your younger self or to some imagined standard. Instead, focus on the actual experience you're sharing with your partner in this moment. Here's what's remarkable. When you do this consistently, not only does your emotional experience improve dramatically, but your physical function, often improves too because you're no longer sabotaging it with performance anxiety. Mistake number 2, ignoring the relationship context and communication. Now let's move to mistake number 2, and this is one that has enormous impact, but that most men completely overlook. Mistake number 2 is trying to address intimate challenges without addressing the relationship context and communication patterns. Here's what I mean. Most men think of intimate challenges as purely individual issues. I'm having this problem, so I need to fix it myself. But intimacy doesn't happen in isolation. It happens within a relationship. And the quality of that relationship, the communication, the emotional connection, the trust, the unresolved tensions directly impacts intimate function. Let me give you a real example. I had a patient, I'll call him John, who came to me with significant intimate dysfunction. He tried various treatments with minimal success. So I asked him about his relationship, and here's what emerged. He and his wife had stopped having meaningful conversations years ago. They'd built up resentment over various issues that had never been addressed. They rarely showed non-sexual affection. They essentially lived as roommates who occasionally attempted physical intimacy, and John was confused about why his body wasn't cooperating. But here's the biological reality. Your body responds to your emotional state and relationship context. When there's emotional distance, unresolved conflict, or lack of genuine connection with your partner, your body knows that even if you're not consciously aware of it. And in that context, physical arousal and function become difficult because your body doesn't experience the situation as safe, connected, or desirable. Think about it from an evolutionary perspective. Physical intimacy is supposed to happen in contexts of connection, safety, and mutual desire. When those elements are missing, your body's natural response is caution, not enthusiasm. So emotionally, what does this mean? When men try to pursue physical intimacy without nurturing the emotional relationship, it creates pressure rather than desire for their partner. It makes intimacy feel obligatory rather than connected. And that emotional context makes physical intimacy less satisfying for both people, which creates more anxiety and frustration, which worsens the physical challenges. It's a vicious cycle. But here's the powerful part. When you improve the relationship context and communication, intimate function often improves dramatically without any direct physical intervention. I've seen this countless times. Couples start having real conversations again. They address resentments that have been festering. They show consistent non-sexual affection. They rebuild emotional connection. And suddenly, intimate challenges that seemed insurmountable start resolving themselves. So, what does fixing this mistake look like practically? First, create daily emotional connection outside of intimate contexts. Have at least one real conversation every day where you're fully present. No TV, no phone, genuine engagement with your partner. Ask about her thoughts, her feelings, her experiences. Actually listen to the answers. Second, show non-sexual physical affection regularly. Hold hands. Hug for more than 2 seconds. Gentle touches that communicate care without expectation. This rebuilds physical comfort and connection without the pressure of intimate performance. Third, address any unresolved issues or resentments in your relationship. Not during intimate moments, but in separate, dedicated conversations. You can't build genuine intimacy on top of unrest conflict. And fourth, express appreciation for your partner regularly, not just for what she does, but for who she is. Notice and acknowledge her qualities, her efforts, her value. This creates the emotional safety and connection that intimacy requires. Now, I know some of you might be thinking, Dr. Narita, I came here for solutions to physical challenges, not relationship advice. But here's what I need you to understand. You cannot separate intimate function from relationship quality. They're completely intertwined. The best physical interventions in the world can't overcome a relationship context that doesn't support intimacy. But when you improve the relationship context, even modest physical interventions become dramatically more effective. So if you've been trying to fix intimate challenges without addressing your relationship and communication patterns, you've been missing the foundation that everything else builds on. Mistake number 1, not managing stress and lifestyle factors. All right, we've reached mistake number 1, the most common and most impactful mistake men make regarding intimate health. Mistake number 1 is not recognizing how profoundly stress and lifestyle factors undermine intimate function and not taking them seriously enough to actually address them. Let me be direct about this. Chronic stress is probably the single biggest saboteur of intimate health in men over 60. And most men either don't realize how stressed they are, or they acknowledge the stress, but don't connect it to their intimate challenges. Here's the biology you need to understand. When you're chronically stressed, your body produces elevated levels of cortisol, your primary stress hormone. Cortisol is incredibly useful in short-term crisis situations, but when it's chronically elevated, it wreaks havoc on your system. Chronically elevated cortisol directly suppresses testosterone production. It constricts blood vessels, reducing circulation. It activates your sympathetic nervous system, which, as we discussed, interferes with intimate function, and it creates fatigue, mood disturbances, and reduced motivation. All of these factors directly undermine intimate health. But here's what most men don't realize. Stress isn't just obvious things like financial pressure or work deadlines. It's also poor sleep, chronic pain, lack of physical activity, poor nutrition, social isolation, and unaddressed health concerns. Your body experiences all of these as stressors, and they all elevate cortisol and undermine intimate function. Let me tell you about a patient I'll call Michael. Michael was 65, struggling significantly with intimate health. He'd tried various treatments with limited success. When I took a comprehensive history, here's what I found. He was sleeping poorly, barely moving his body, eating terribly, had uncontrolled high blood pressure, and was socially isolated. He was carrying enormous stress, but didn't recognize it because he wasn't experiencing traditional work stress. But his body was absolutely in a chronic stress state. And in that state, no intimate health intervention was going to work well. So we addressed his lifestyle systematically, improved his sleep, got him moving regularly, cleaned up his nutrition, managed his blood pressure, encouraged social connection. Within 3 months, his intimate function had improved more than it had in the previous 3 years of various treatments. Not because we found some magic solution, but because we removed the chronic stress that was sabotaging his body's natural function. Now, emotionally, chronic stress creates a sense of being overwhelmed, depleted, and disconnected from your own body. You feel like you're just getting through days rather than actually living them. And in that state, intimacy feels like one more demand, one more performance requirement rather than something pleasurable and connecting. That mindset makes intimate challenges worse, which creates more stress, which worsens function further. So how do you actually fix this? First, prioritize sleep with absolute seriousness. If you're sleeping poorly, address it. Get evaluated for sleep apnea if you snore heavily. Create consistent sleep routines. Make your bedroom conducive to quality sleep. Your body needs quality sleep to produce testosterone, manage stress hormones, and support all the systems involved in intimate function. Second, move your body consistently. Not intense workouts unless you enjoy them. Just consistent, moderate activity. 25 to 30 minutes of walking, swimming, gentle cycling most days of the week. This reduces cortisol, improves circulation, supports testosterone production, and enhances mood. All of these directly support intimate function. Third, address your nutrition. You don't need a perfect diet, but you need adequate protein, plenty of vegetables and fruits, healthy fats, and consistent hydration. Your body can't function well in nutritional poverty. Fourth, manage your blood pressure, blood sugar, and cholesterol. These aren't abstract health metrics. They directly impact circulation and intimate function. Fifth, cultivate genuine stress reduction practices. That might be meditation, time in nature, engaging hobbies, social connection, whatever genuinely reduces your subjective stress experience. And finally, address any chronic pain, untreated health conditions, or medication side effects that might be creating ongoing stress or directly impacting function. Here's the core message. Your intimate health doesn't exist in isolation from the rest of your health and lifestyle. They're completely connected. When you're chronically stressed, poorly nourished, sedentary, and sleep deprived, no amount of focus on intimate function alone will create lasting improvement. But when you address these foundational lifestyle factors, intimate function often improves dramatically, sometimes without any direct intervention at all. All right, Let's take everything we've covered and create a clear, actionable plan you can start implementing today. Action. Step 1. Shift from performance to presence. Before intimate moments, take 3 slow breaths to ground yourself and release evaluation mode. During intimacy, focus on connection, rather than monitoring performance. Make eye contact. Communicate appreciation. Stay present with your partner. When you notice yourself getting into your head, gently redirect to presence and connection. Action. Step 2. Rebuild relationship context and communication. Create daily emotional connection through genuine conversation. No screens, no distractions, just real engagement with your partner. Show consistent non-sexual affection, holding hands, hugs, gentle touches that communicate care. Address any unresolved conflicts or resentments through dedicated conversations outside of intimate moments. Express regular appreciation for your partner's qualities and contributions. Action. Step 3. Systematically address stress and lifestyle factors. Prioritize sleep quality. Address any sleep disorders. Create consistent sleep routines. Engage in consistent, moderate physical activity, 25 to 30 minutes most days. Improve nutrition with adequate protein, plenty of produce, healthy fats, and good hydration. Manage cardiovascular health, blood pressure, cholesterol, blood sugar. Cultivate genuine stress reduction practices that work for you. Here's the key to making this work. Don't try to implement everything simultaneously. Pick one thing from this action plan, just one, and commit to it for 2 weeks. Maybe it's the daily conversation with your partner. Maybe it's 25 minutes of walking every day. Maybe it's 3 deep breaths before intimate moments. Whatever feels most accessible, start there. Build consistency with that one change, then add another. Small, sustainable adjustments create lasting transformation far more effectively than attempting dramatic overhauls that can't be maintained. And remember, these aren't temporary fixes you do until things improve. These are lifestyle patterns that support optimal function long-term. I want to take a moment to address something important. If you're watching this and recognizing that you've been making these mistakes maybe for years, you might be feeling some regret or frustration with yourself. Let me say this clearly. You've been doing the best you could with the information you had. Most men have never been taught how to approach intimate health holistically. They've never learned about the connection between stress and function or relationship context and physical response or presence and performance. You weren't making mistakes because you were foolish or careless. You were making mistakes because you didn't have complete information, but now you do. And what matters isn't how long you've been approaching things differently. It's that you're willing to learn and adjust now. I've seen men in their 70s make these changes and experience profound improvements. Age isn't the barrier. Willingness is what matters. Your intimate health isn't over. Your vitality isn't finished. Your ability to experience connection, pleasure, and satisfaction isn't gone. But it does require approaching things differently than you have been. And the beautiful part is that these changes, shifting from performance to presence, improving relationship communication, addressing lifestyle stress, they don't just improve intimate function, they improve your entire quality of life. You'll feel more connected to your partner, less anxious, more energized, more like yourself. So don't carry regret about what you didn't know before. Just carry forward the commitment to implement what you know now. Because when you do, when you focus on presence, nurture your relationship, and address the lifestyle factors that undermine function, things can and will improve. We've covered something truly important today. The 3 most common intimacy mistakes men make, and more importantly, exactly how to fix them. You now understand that intimate health isn't just about physical mechanics. It's about psychological approach, relationship context, and overall lifestyle health all working together, and you have a clear action plan to address each of these areas. Now it's your turn to implement it. If this video gave you insights you didn't have before, hit that like button. It helps other men who need this information find it. Drop a comment below. Let me know which mistake you recognized in yourself or which action step you're going to start with. I read every comment. If you haven't subscribed yet, please do that now. I create content every week for men who refuse to accept that aging means declining. This community is about maintaining vitality, connection, and quality of life through informed action. And here's what I want you to remember as you move forward. Intimate challenges after 60 are not inevitable, irreversible, or hopeless. With the right understanding and the right approach, you can experience significant improvement regardless of your starting point. This isn't about achieving some idealized standard. It's about being fully present, deeply connected, and functioning as well as your body's capable of. And those things are completely within your reach. You've lived a full life. You've gained wisdom and perspective. Now apply that wisdom to understanding what your body and your relationship actually need. Small changes in how you approach intimacy, how you communicate with your partner, and how you manage your overall health can create profound transformation. Start today. Start small, but start. Your vitality isn't finished. Your intimate life isn't over. Your best years can still be ahead of you. I'm Dr. James, and I'll see you in the next video.